Thank you, Mr. Speaker. Appreciate the lady yielding. Mr. Speaker, we're faced with an unenviable choice of the facts that there are infinite demand for health care. There is no top on the amount of health care costs necessary to provide all the health care that we want for everybody in this country. And we have limited resources within which to do that. The real question is, does Obamacare to take up that task by asking government to make those hard choices? Or do we as individuals and families and caregivers make those harder choices for ourselves? I believe that the bill that we'll get to vote on today moves us toward that direction. This isn't about health care per se. This is about how do you pay for it. Insurance is not a magic bullet anywhere across the spectrum. Insurance is simply a scheme in which we risk manage together. We put a certain amount of money into a bucket, assuming not all of us will have the risks or suffer the risks that we want to cover. And if we do, we got to put more money in. If we don't, then the system works. And this is about having to confront that choice that there's way too much costs for the amount of resources that are available in any circumstances, and it's hard. Many of my constituents ask, why did Republicans have spent 6 years railing against Obamacare and not have the fix available on inaugural day? Well, this is Exhibit A. This is hard stuff. It's, even among Republicans, we've got more than 218 votes among us, and we can't agree among ourselves necessarily what ought to go forward. But I do know this, that we're down to the final choice. Do we keep Obamacare and the failure that is confronting us and will continue to be there, or do we take a chance on moving forward something different, moving toward freedom, moving toward choice, giving states back the opportunity to decide for their indigent population, how should they take care of them? I don't think anybody in Washington, D.C. can come up with a plan that fixes that for all 50 states. I trust my colleagues in Austin to make that happen far better than anybody I would trust in D.C. And this bill moves that direction, and that's the right direction for it to go. This is a hard choice. But for me, it's relatively straightforward. You keep Obamacare with a no vote, you move toward a brighter future for health care in this country and the way we pay for it, who pays for it, and how we get that done by a yes vote. And I encourage my colleagues to vote yes on this bill, and I yield back.